Hello everyone, welcome to the AY tutorials. Today we are going to study thyroid and antithyroid drugs. Introduction. Thyroid gland secretes three main hormones: thyroxine, triiodothyronine and calcitonin. Thyroxine, that is T4, triiodothyronine, it is nothing but the T3, and these two, they are important for the growth and development, and both are considered as the thyroid hormone. Then calcitonin is important for the control of plasma calcium levels. Functional unit of thyroid is follicle or acinus, and its structure of follicle is cavity surrounded by epithelial cells, which is filled with the thick colloid called as thymoglobulin, and thymoglobulin is nothing but the large glycoprotein. Thyroglobulin molecule contains 115 tyrosine residue, and its follicle have high blood supply. Synthesis, storage and secretion of thyroid hormone. It involves the following steps. First one is uptake of plasma iodide by that follicle cells. Then oxidization of iodide takes place, and iodination of tyrosine residues of thyroglobulin is occurs. Then coupling, and then secretion of thyroid hormone. And then there is the peripheral conversion of T4 to T3. Uptake of plasma iodide by follicle cells. Regular iodine requirement of body is 30 to 50 milligrams, which is fulfilled by food and water, and about 1/5 is present in thyroid. Iodide is captured from blood and moved to the lumen by two transporters: sodium iodide transporter, which is located at the basolateral surface of thyrocytes, then pendrin iodide chloride portal at apical membrane. Iodine uptake is energy dependent process, energy provided by sodium potassium ATPase. Oxidation of iodide and iodination of tyrosine residues of thyroglobulin. Captured iodide carried across the membrane by pendrin transport and oxidized by thyroid peroxidase enzyme, that is here thyroid stimulating hormone by coupling with the iodide with the help of thyroid peroxidase enzyme, it is produces iodinium hypoiodous acid and enzyme linked hypoiodate. Then by binding to the tyrosyl residue of thyroglobulin, it produces monoiodotyrosine and diiodotyrosine. Coupling. Coupling is the oxidative reaction catalyzed by same thyroid peroxidase enzyme. Thyroglobulin is efficient protein helps for this reaction. Pair of iodinated tyrosyl residue coupled together to form T3 and T4. Two molecules of diiodotyrosine is equal to the thyroxine, that is T4. One molecule of monoiodotyrosine plus one molecule of diiodotyrosine is equal to the triiodothyronine. Secretion of thyroid hormone. Normal human thyroid secretes 60 to 90 microgram of T4 and 10 to 30 microgram of T3. The iodinated residue of thyroxine get transferred to the inferior of the follicles, where it stored as a thyroid colloid. After release, it uptake by endocytosis after stimulation of thyroid stimulating hormone. Then peripheral conversion of T4 to T3. Peripheral tissues like liver, kidney, they convert T4 to T3, and target tissue take T3 from the plasma dependent upon their metabolic need. While our brain and pituitary, it takes T4 and converted into T3 with their own cell. And drugs like some propyl thiouracil inhibit conversion of T4 to T3. Here is the mechanism of action of propyl thiouracil. They inhibit the conversion of T4 to T3. Here I have mentioned some functions of T3 and T4. They both are having almost the same functions, that is growth and development, intermediary metabolism, calorigenesis, cardiovascular system, nervous system, skeletal muscle, gastrointestinal tract functions, kidney, hemopoiesis, and reproduction. Here I have explained those functions one by one. First one is growth and development. Essential for normal growth and development of the body. The most remarkable action is metamorphosis of tadpole to frog. The tail is used up to build lungs, limbs, and other organs. The action cannot be categorized as catabolic or anabolic. T3 and T4, they have a role in protein synthesis, that is for the translation of the genetic code. Therefore, congenital deficiency of T and T resulting in cretinism and delayed development of organs or deficit dendrites, ramification, synapse formation, and impaired myelination. Then second one is intermediary metabolism. Thyroid hormone have remarked effect on thyroid lipid, carbohydrate, and protein metabolism. In that lipid, T3 and T4 potentiate the action of catecholamine and lipolytic action. They increases the lipolysis. Suppress phosphodiesterase. They increases CMP and increase the plasma free fatty acids. Carbohydrate, T3 and T4 increases the carbohydrate metabolism, increases sugar utilization by the tissue, but faster absorption of glucose from the blood. So T3 and T4, they are responsible for carbohydrate metabolism and increases the sugar utilization. Increases the absorption and less metabolism causes hyperglycemia and diabetic like state. Therefore, hyperthyroidism causes insulin resistance. This point is very much important. Then in case of protein, T3 and T4, they increases the synthesis of certain protein which used as a protein source by the body, but prolonged action causes negative nitrogen balance and weight loss. At low concentration of T3 and T4 inhibit the mucoprotein synthesis. T3 and T4 increases the oxygen consumption. Calorigenesis, T3 and T4 increases the basal metabolic rate by increasing cellular metabolism, and which is responsible for maintaining the body temperature during calorigenesis, and which is responsible for oxidative phosphorylation, and that increases the heat, but this reaction only occurs at high dose. Then on cardiovascular system, T3 and T4 causes hyperdynamic state of circulation which increases blood volume, and it also increases heart rate, contractility, and output of the heart by acting on contractile element. During hyperthyroidism, it causes arterial fibrillation and other regularity like CHF and angina. CHF is congestive heart failure. Then nervous system. On nervous system, T3 and T4 deficiency causes mental retardation or cretinism, and also hyperthyroid individuals are anxious, nervous, excitable, or produces tremors. Skeletal muscles. Hypothyroidism causes swelling of skin and underlying tissues. Hyperthyroidism causes increased muscle tone, tremor, and weakness. Then on gastrointestinal tract, T3 and T4 causes increased gut activity which causes diarrhea. Then on kidney, hypothyroidism causes diuresis while normal person not causes diuresis. Then hemopoiesis, T4 increases the process of RBC formation, that is erythropoiesis. Therefore, T4 treatment given to the patient suffering from anemia. Then on reproduction, thyroid has an indirect effect on reproduction. Fertility is impaired in hypothyroidism, and oligomenorrhea, that is infrequent menstrual periods are there. Normal thyroid function is required for the maintenance of pregnancy and lactation. Mechanism of action: T3 and T4, they penetrate the cell by active transport. They combine nuclear thyroid hormone receptor, that is TR, which is this receptor is steroid and retinoid superfamily. T3 has 15-fold higher binding to the TR, that is thyroid hormone receptor, than T4. This hormone receptor complex bind to the DNA via zinc fingers, undergo conformational changes which causes gene transcription and production of specific mRNA and protein synthesis. Because of this, it gives various metabolic and anatomic effect like tachycardia, arrhythmia, increased blood pressure, hyperglycemia, etc. Relation between T4 and T3: normally T4 more secretes than T3, but in iodine deficiency this difference decreases. Then T4 15 times more tightly bound to the plasma protein. T3 is 5 times more potent than T4 and acts faster peak effect T3 in 1 to 2 days and T4 in 6 to 8 days. About one third of T4 will convert in T3. Then there are some preparations. For example, one thyroxine is more preferred than one thyronine. Uses: the most important uses of thyroid hormone are as replacement therapy deficiency states, that is in cretinism, adult hypothyroidism, myxoedema coma, non-toxic goiter, thyroid nodule, papillary carcinoma of thyroid, and there are some other uses also. Cretinism. Cretinism is caused due to the failure of thyroid development, that is sporadic cretinism, due to extreme iodide deficiency, that is endemic cretinism, and mostly during infancy or childhood. And treatment is treatment with thyroxine, that is 8 to 12 micrograms per kg by daily physical growth and development are restored and further mental retardation is prevented. Then adult hypothyroidism, that is myxoedema, it is the commonest endocrine disorder which is caused due to the autoimmune thyroiditis and thyroidectomy. Antibodies generated against this thyroid peroxidase or thyroglobulin causes adult hypothyroidism. Drugs that can cause the hypothyroidism are 13 iodides, lithium, and amiodarone, which is treated with T4, that is 50 micrograms per day. Then subclinical hypothyroidism. In this disorder, free serum thyroxine levels they increases, but thyroid stimulating hormone, that is TSH level, decreases, and this condition is treated with T4. Myxoedema coma. It is an emergency condition where progressive mental deterioration is there, which is caused due to the deficient production of thyroid hormone, that is hypothyroidism, and this condition is treated with liothyronine, that is T3, but high risk of cardiac arrhythmia and angina is there. Then IV dose of T3 is given for myxoedema coma with the dose of 10 micrograms per 8 hours. Then non-toxic goiter, it is the endemic due to iodine deficiency and sporadic due to defect in hormone synthesis. In above cases, deficiency of thyroid hormone leads to the increase in thyroid stimulating hormone that causes enlargement of thyroid gland. Treatment with T4. Thyroid nodule. When T4 treatment is started, thyroid stimulating hormone synthesis gets suppressed, that causes normal functioning of nodule function while non-functional nodules are not respond. Papillary carcinoma of thyroid. This type of cancer is caused due to the thyroid stimulating hormone overproduction, and treatment with T4 causes decreased TSH production. Then other uses: T4 is used for the treatment of refractory anemia, mental depression, and menstrual disorder or infertility. We will see antithyroid drugs in next part of the video. If you like this video, please like, share and subscribe to the AY tutorials. Thank you.